Honorable Opposition Leader.
Thank you, Mr. Speaker.
Question blomi mi like Toromo Yosem Golo, Minister of Law Health. Mi like him Prime Minister, Deputy Prime Minister. No, other minister will take note. Mr. Speaker, in the last 2 to 3 weeks, there has been critical shortage of medicine right throughout the country, medical drugs. We have received letters coming in from PHAs, 4 PHAs throughout the country, and they've indicated a critical shortage of medical drugs right throughout the country. A week ago, or 2 weeks ago, Mr. Speaker, I was in Alatau, and I was fortunate enough to be at the General Hospital when I was informed of the critical shortage of drugs. And thank you, Minister, for calling me back to explain. But this is not only about Alatau and Milne Bay province. It is about the shortage up at Hela. It is about the shortage within the Lutheran Church, churches' health services. And it is about shortages in all the regions of Papua New Guinea. Mr. Speaker, there are a lot of deaths happening as we speak, and I'm talking about curable diseases, where we can sort out these issues, the medical issues. There is a greater need for urgent attention, not only from the minister and his secretary, but from the government as a whole. So question to me go Minister Osam. Minister, Osam, you may short the money? Osam, or people blame me, for kissing this important margin goal or housing? Or, Minister, Osam, you get management issues inside the Department of Health? Or Osam, some money in the budget where it's supposed to be monies for the health sector or health department have been reallocated to other sectors. You may say some life people blame me is very important. Now we cannot neglect and continue to allow the shortage of drugs, medical drugs, to our hospitals in Papua New Guinea, and not only hospitals, major hospitals, but the health centers and the clinics, the aid posts in our electorates as well. Thank you, Mr. Speaker.
Honorable Minister of Health.
Thank you, Mr. Speaker. I'd like to thank the opposition leader for this very important question. Firstly, it's not so much about funding. According to the records, government this year allocated 295 million kina lo medical supplies in the country. To date, according to the latest information mixing now, today we give over 150 million kina lo this amount. Today, this last week, 50 million kina and government can release him lo medical supplies lo yumi. Yumi look sa lo this la issue lo medical supplies affecting plenty of the country. We see some list going up in some of our hospitals, like all director of curative health services, all putting up Toksawe, also operating theatre scale down, or something also. We are fully aware, and we always constantly communicating with the medical supplies manager, executive manager of medical supplies. All the CEOs, they're giving us up-to-date information on what is actually happening. Yes, we can talk so clear also today. According to the 5 area medical or provincial medical stores in the country, we got up to 60%. 60% of what is required now is 40% stop lot as well. At the moment, there's a procurement process that's going through. They got tender now. There's a call for tender that's currently in place, and we hope, and our plan is to reach about 70–80% all provincial medical supplies, provincial transit stores by the end of this year. Now, by supporting to first quarter of 2026. That's the information we give to date. We are fully aware of what's happening in the country. Now, we are trying our best to see that medical supplies procurement, we go along medical provincial transit stores, and then from the provincial medical transit stores, our logistics companies can locate medical transit stores to the respective primary healthcare facilities. Now, some of the time, Mr. Speaker, one of the important issue we are finding out now is we have logistics companies are responsible for one regions, and we now too. There's a lot of thefts going on with the medical supply system. Time all Marasin Lucy medical all provincial transit stores, they go one provincial the primary health facilities. You get some Marasin or Silim or Namelo Tesla. Many of these are now ending up at the market sites and Platilan public in it today. Mila talks have clearly please you looking me got online is all drugs where you got all medical catalog long all talks have na Mila by he got all fraud squad in place. There's a system in place to actually arrest anyone who is getting medical supplies low side that will Salim Marasin stuff. Something Mila talk clear. You try best blame me. I need to plan challenges. As I speak today, he got all people track where supposed to deliver him on Marasin long Mount Agenda, Kolong Benimo Kukawe go on top lo Highlands region. He got some lady come up now long on top lo section long up now. Instead of only carrying on Marasin go, he got all Marasin all the kai step start as long lay. Now wait as all Salim Marasin go yet start. There's some issues going on at the moment along the Okuka way. So I appeal to some of our people out there to please, Olokman, allow him all Marasin supply go. These are some of the issues that we are actually facing. So that's, Mr. Speaker, we're trying our best under very difficult circumstances. I call upon the members of Parliament to also come in. Thank you, the opposition leader, who also was there at Alatau Provincial Hospital. Time during last time when he called me that time, I was with the World Bank team. We were looking through our system. We have a M supply system, in office plumbing, where we track the amount of medical supplies that's going through all the provincial transit stores. Now you got all hospital pharmacies. All the provincial hospitals, you got all hospital pharmacies to stop. So this we found that there's also a lack of communication between the provincial transit stores and the hospital pharmacy sections. So this information was clear all along. When something only got at stock level, I call on all of those to actually communicate before only put him all talks have go out. Now two talks have go out. Sometimes the check him CEO was there's information and true also we got lack of supply load this low section so respective hospitals. Some of the CEOs were not aware that talks have go out and they were issued by the respective curative health directors. Section 48. Section 49 of PHA Act, yes, allow him direct the curative health to issue or look at him housing, but at the direction of the CEO. Now CEO almost talks about board past them. PHA board must survey also make that issue stop now. Almost saw what's happening before long. Only give talk survey, only put him out talk survey. Not the point where we'll talk about planting when I die because no got Marasin. Even like survey law, one all die come up, one areas, one place. Now I want to get we need to get this information through so you may confirm him now, verify him. All die come up, one lab now, one cause also die too. And something I'm like ask him. These are the circulation of video going around in the social media now. Talk like at PNG. Remember, Mr. Speaker, this video was circulated long time of COVID-19. That video was circulated COVID-19. So him planting lani die lohabna. Even got this low mortuary capacity low, all the die body inside like PMCH. Today I want to make it like clear that at the moment PMGH addressed that area. Only got now 300 capacity of, we can put him die line or body inside Lahab. At any given time, they have about 80 to 90% occupancy rate. So meaning also you got space it. So we have no issue with our body lying all over the place in a mortuary or PMGH. So please, we like ask him also, when we get this kind of information, he make him clear, talk. Not talk clear. We know that there's challenges. There's a lot of challenges going on. You know, medical supplies procurement, provincial transit stores. From there, going back to communities. It's taking plenty of work to make him. I appeal to every one of us to portray to us the right information. We also always trying our best to address this. Thank you, Mr. Speaker.